Good afternoon, Milwaukee, and welcome to another installment of Listen MKE, a partnership between WUWM, Milwaukee's NPR, the Ideas Lab at the Milwaukee Journal-Sentinel, the Milwaukee Public Library, and Milwaukee Public Television. I am investigative solutions reporter Talis Shelbourne with the Milwaukee Journal-Sentinel, and I will be co-hosting with the environmental reporter at WUWM, Milwaukee's NPR, Susan Bentz. We are here with three guests: Milwaukee Mayor Tom Barrett, Milwaukee Waterworks Superintendent Karen Dettmer, and the new Milwaukee Health Commissioner Kirsten Johnson. We want to thank all of you for being here and thank everyone who submitted questions for this event. We've incorporated some of those into our own questions. And Susan will get us started with our first question, which does incorporate a submitted question. So Susan?
That's right. We've already heard from a lot of people, and we'd like to address this question to each of you in turn. Mayor Barrett first, I think, seems fair. He's lived this issue the longest, I think. What will it take from your perspective and from your department's, participation in this issue to address the lead crisis in a quick and efficient fashion? What will it take?
Well, I think it'll take a partnership with the federal government, and fortunately, with President Biden and with the support of Senator Baldwin, with the support of Congresswoman Moore and other Democrats in our delegation, we have, I think, at this time, a once-in-a-generational opportunity to address these issues. And I'm glad that we're talking about this in terms of lead, because there really are two distinct issues here. There is the issue of our older housing stock, where we have a lot of lead-based paint that we believe, from a health perspective, has had the most deleterious impact on young people in particular. In other words, when you see elevated lead levels in children, by and large, that is attributable to lead paint. Not 100%, but the overwhelming majority, we believe, of those lead cases are as a result of lead paint. And so we have always had a focus on making sure that we get resources for lead paint remediation, which is an expensive process. And over the last few years, we've done it in a more extensive basis. For many, many years, we were focusing on the windows and window sills. Now, working with HUD, we are taking a more expanded approach and doing more lead remediation of other parts of homes and apartments as well. So the lead paint issue is very, very real. Probably, though, the issue that's received more media attention and more public attention is the issue of our aging infrastructure, which means our lead-based, the lead that is contained in our laterals. And I'm being careful with my words here, and Karen can correct me if I'm wrong in any things that I say here, but our water mains do not contain lead in them. Our water mains, which are basically the larger pipes that run through the city, even though they're old, and we just last week were out with the Secretary of Labor in replacing some of those, they do not contain lead. They are very, very old, in some instances well over 100 years old, but they do not contain lead. The smaller pipes that run from the water mains to homes and businesses do contain lead in the infrastructure, not in the water, but in the infrastructure themselves. They're lead-based, there's lead in those lead laterals. That becomes an issue when those laterals are disrupted, when they are jostled, when they're hit, when there's construction going by. That's when you're likely to see lead basically coming off the lead laterals themselves and getting into the water supply. So we don't have lead in our water. We have lead in lead laterals that we're very, very concerned about. But I actually consider this an aging infrastructure issue as much as a lead issue. And that's not as an excuse not to do something. I think we still have to do it, because we still have in the neighborhood of 70,000 lead laterals in the city of Milwaukee. We've replaced roughly 3,000 to 4,000 in the last 3 years. But you can see at this pace, it would take us literally decades to do so. So that brings us to the American Recovery Act, and it brings us to the Jobs Bill. And when the American Recovery Act first passed, my thinking was, okay, let's have sort of a balanced approach here. Let's put resources both into lead-based paint and lead-based paint remediation. So that would go to working with the health department. And then let's also work with the water department to see what we can do with the Milwaukee Water Works, to see what we can do to put resources into speeding up that decades-long problem that we will face in replacing the aging infrastructure, because we know, again, there's lead in the laterals, not in the water, still a legitimate issue. During the course of my conversations with Senator Baldwin, with Congresswoman Moore's staff, with others, what I came to realize and believe, and this is still not borne out yet, is that the jobs bill, the infrastructure bill, is likely to contain money for lead laterals, for lead lateral replacement. In fact, the blueprint that was introduced by President Biden has basically full replacement of lead laterals. I haven't seen that in the Republicans' counterproposal, but I believe that my conversations with Senator Baldwin and other people in Washington who are involved in this, they feel that the final bill, the infrastructure bill, will contain a significant investment in lead infrastructure replacement. What that means is that we can use the ARP money, the Recovery Act money, more in the area of lead paint remediation. And so what is happening right now is I've asked both the health department and the water works to develop scenarios as to how they could spend significant amounts of money. And I'm talking tens of millions of dollars over the next few years for replacements. And I know both Karen Dettmer and Kirsten Johnson are taking that request very seriously and are working with their staff to develop plans so that we can move forward on that. So that's a very, very long answer to your very, very short question. But it is
you gave us lots of information, though.
As one of the issues that we want to right.
Absolutely. So we've got a good overview there, Superintendent Dettmer. What would you add from your perspective as you're looking at it? Are you looking at, for example, increased coordination of departments across the city, or creating more jobs to get these pipes out, and that as being part of the lead issue?
Thank you, Susan. And first, let me say, Mayor Barrett, nicely done. There, no corrections. All the points were exactly correct. We do not have detectable levels of lead coming out of Lake Michigan. We do not have lead in our water mains or in our infrastructure in our treatment plants. The lead that is in the water is coming from the service lines, as well as interior plumbing that may be in properties, from fixtures, interior plumbing, galvanized materials that are inside housing, and again, that aging housing infrastructure, as well as the service lines that are feeding those houses and properties. So with that, it does come down to the funding. We need a federal partner that will provide the funding, not just to us in the city of Milwaukee, but many communities throughout the state of Wisconsin are in need for funding. Recently, the Department of Natural Resources announced $63 million that they were reallocating to the Safe Drinking Water Loan Program that they're providing to municipalities, much like Milwaukee, but smaller municipalities that may have 200 lead service lines within their community. And they're allowing that funding to be allocated for the private side replacement. So we've applied for about $9 million of that funding. We're excited for future opportunities, and we fully anticipate that funding coming from any federal infrastructure bills would be allocated through that program. We've well utilized it in the past. We'll continue to utilize it, and we look forward to future. But it's not just about the construction. It's not just about the funding. We need to make sure that funding, as you mentioned, Susan, is going to workforce development. We need to be very purposeful about how we're building our workforce, making sure that we are training people that are in our community that need these jobs, and that we're doing it in a way that trains them not just for lead service line replacements. Involved in a lead service line replacement, we need laborers, we need plumbers, we need inspectors, we need water meter technicians. There are so many jobs involved in that one single aspect because it is very complex work. Electricians. And so what we're working on is looking at collaboration outside of what may be traditional collaboration that the health department and the waterworks have a history of. We're looking at collaborating with Employ Milwaukee, with WRTP Big Step, with Milwaukee Jobs Works, as well as our community partners to ensure that when we're building this workforce, we're doing it purposefully and equitably.
Great. So Commissioner Johnson, the health department that you're leading is working with families whose children have been impacted by either, lead in water or paint. And clearly that's a huge job for your department, and also a department that's working its way out of some tougher times. So when you look now in your fresh chapter with the health department, what's needed from your perspective to right the situation for the city?
Absolutely. Thank you. Thanks for having me. I think from my perspective, as you mentioned, we're moving our way out of the pandemic. So that's what has taken a lot of the work of the health department over the course of the last 15 months. But we're thinking more strategically and more broadly. Historically, the health department is really focused on abatement and case management of children who have high or elevated lead levels, so 15 or 20 or higher. And we're trying to take a step back and really think strategically. How do we collaborate with our community partners, and how do we think about prevention and even children who may have lower levels? And what is it that we can, as a department, can do? So I think we're really in this space where it's an opportunity for us to think much more broadly and holistically about what a comprehensive lead abatement program and sort of how do we address lead as a health department. And of course, working closely with Karen and the mayor's office in that space.
Gotcha. Yeah, and so I kind of want to get a couple of specifics from all of you, and that is on staffing and funds. Do you have an estimate on how many people it will take? Do you feel like there are enough? I know you mentioned plumbers and laborers and needing those people to do that work. How is that in each of your kind of your specific departments? What is that looking like?
Maybe start with Superintendent Dettmer.
Yeah.
Yeah, I can jump in. So we're trying to get a handle on that. Right now, we have a number of staff, as I mentioned, that are working on lead service line replacements, are working on water infrastructure replacement, water main replacement projects, but that's not their sole purpose. So as I mentioned, water meter technicians. Every time a lead service line or any service line is replaced, we have to have a water meter technician go and put in a new meter in that facility. Plumbing inspectors and waterworks inspectors, they have a variety of different jobs that they do. Any new construction, those inspectors are needed. Any water main replacement project, whether it has lead service lines attached or not, we have an inspector on that project. So right now, we really have a number of plans in place. We know that we have an aging workforce. We know that we need to ramp up interest in working for water. And, that may include accountants, that may include customer service representatives. We have such a variety of workforce that we all come together. As I say, it takes a village. It really does. So paring down how many staff we'll need internally, it really comes down to the funding that we receive and making sure that we're ramping up the workforce to meet the funding. We're also talking to the local plumbers union, to all the labor unions, to talk about how they can increase their workforce. We're working with Milwaukee Area Technical College on some training programs. So it's really, we're trying to be as flexible as possible to meet the demand once we have the funding in place.
Excellent. And then I would ask the mayor and the health commissioners to jump in, whichever one of you wants to jump in to kind of just explain what the funding looks like that you need, like if you can have an estimate for that, and also the staffing levels.
I can jump in, certainly.
Well, I think that's a really good question, and it's sort of that's the multi-million-dollar question. And from my standpoint, again, the city is scheduled to receive $394 million under the American. a majority of that, but I can see literally tens of millions going toward lead remediation in homes. But that is going to be dependent on several things. It's going to be dependent on our.
Looks like we
Oh dear.
lost the mayor.
So
See if we
maybe
can try to get him
Commissioner
back.
Johnson.
Yes.
Commissioner Johnson was on the ready, so
Sure.
jump in, please.
From my perspective in the health department, I think we need different types of employees and a different types of a workforce. And one of the shortages we're really seeing, so we have historically been heavily focused on the abatement end, is that there's just a shortage of contractors. So thinking about how we can build that workforce, as Karen mentioned, thinking about plumbers, but also thinking about just people working in construction, painters, many different potentially types of employees that we would need to do some of this work. But in the health department as well, we're really thinking about environmental health strategists, case managers, potentially community health workers. So a broad swath of different types of expertise that can help us think about prevention, working much more closely with our medical facilities and our physicians, potentially OBGYNs and education. There's a lot of opportunity, and we're trying again to think really broadly about what would be the ideal sort of gold standard program that we could put together from the health department.
I don't think we have the mayor, right? So let's swing to another issue. Superintendent Dettmer, we heard last week that the EPA is going to hold a series of discussions around the country, including in Milwaukee, about the lead and copper rule. And this gets a little wonky, but it's very important. It was created to protect drinking water. It gives that, structure around the regulation. So this first roundtable is taking place June 3rd in Pittsburgh. It'll be coming up, we don't know exactly when, in Milwaukee, perhaps you know. So let's start with you. And can you tell us about the significance of the EPA choosing Milwaukee? And could you also lay out what your recommendations would be sort of generally on how that rule should work, how it should be revised for the health of our kids and families?
Yeah, and I think wonky is the key word.
I know.
This is the lead and copper rule is hundreds of pages long, and we're no stranger to it. We've been in compliance with the lead and copper rule since its inception in 1996, and shortly after, we added corrosion control treatment by way of orthophosphate to our water to ensure that we were in compliance. But I think it's important to note that the lead and copper rule is looking at what's feasible for water utilities throughout the country in determining what those compliance levels of lead and copper are. And when I say what's feasible, I want to make sure that it's clear the standards that are put forward in compliance for lead and water at the tap are not health-based standards. We certainly know that no level of lead is safe for consumption, and we strive to bring those levels of lead as low as possible. But over that, as I mentioned, the lead service lines that we have in the city of Milwaukee, as well as plumbing fixtures, interior plumbing in these facilities. So we have an idea of how far we can reduce and how much we can reduce that level of lead and water at the tap. But really the only way to make it non-detectable in many cases is to use a water filter. And that's why we've worked with the health department to ensure that our messaging is accurate with what they recommend. And that is that women who are pregnant or may become pregnant or who are breastfeeding should use a NSF 53 certified filter for removing lead and other metals in water, as well as children under the age of 6, because we want to ensure that it is as protective as possible. That said, there are many provisions in the lead and copper rule revisions that are really good. I think they're a step in the right direction. And there are many provisions that maybe don't go far enough, but are worth discussing for future. And it's a great opportunity for the community to come to the table. We have a number of community partners that we've already been working with, and we'll be inviting to that roundtable. And we're so excited that the EPA chose the city of Milwaukee. I think it is a discussion on how far Milwaukee has come over the past 4 years with our lead service line replacement program, how we've seen through these years a continuous collaboration between Milwaukee Health Department and Milwaukee Water Works in ensuring that our messaging to the public is clear and concise, and we're always moving forward to better that messaging. So this will be a good opportunity for us to listen, as well as for the EPA to listen to the community and the elected officials and the experts on this.
Just a quick follow-up on that, Superintendent Dettmer. Do you think that in fact Milwaukee might have been chosen because we have so many old lead pipes? And do you think that a more stringent, even stricter rule could help push toward, quicker solutions?
Well, I think that part of it is the number of lead service lines, but I think the other aspect to that of why Milwaukee was chosen is because we have been in compliance with the lead and copper rule, because our corrosion control treatment is so effective. So it's a collaboration of the number of lead service lines, the fact that we are proactively replacing the lead service lines, even though we are not under EPA order. So we've heard other communities that have, quickly gotten their lead service lines replaced. Well, they were under EPA order to do so because they were not in compliance with the lead and copper rule. So with that said, I think it's a combination. They see that we want to do better. They know that we've had a very successful corrosion control treatment program in place for over 2 decades, and they want to hear from us on the issues that we've had in increasing the number of lead service lines that we've replaced, as well as a current pilot study that we're doing right now, where we're looking at our corrosion control treatment, our water quality parameters, to ensure that treatment is optimized, because it will take a number of years, regardless of the amount of funding, to get those lead service lines replaced.
Okay. Talis, I think you're up.
And I want to give the mayor a chance to answer our earlier question there. Before we just remind everyone too that this is a Listen MKE event, which is a partnership.
I apologize for the technology issues very much, and I'll try to stay with you as long as I can here. I don't know what the issue is, but when I dropped off, I was talking a little bit about the challenge we have, and this is before we got to the copper rule. Was one of the biggest issues that we have here is really a personnel issue, and it's very, very important for me to have these dollars spent here. But I also want to create economic opportunities for the people who live here, and I do foresee tremendous opportunities for workforce development. And so we also will be working with Employ Milwaukee. We'll see whether there's a way to work with MATC. I don't know the answer to that question, but we're going to need people to do the lead paint remediation, and we're going to need people to do the lead lateral replacement. And these are both multi-year projects. And so there are going to be opportunities here. And again, it shouldn't be a surprise to anybody that the mayor of Milwaukee wants these jobs to go to people from particularly the neighborhoods where people need the jobs, as opposed to having people driving from out of state to do this work. So the question that was posed to me before I was disrupted was, how much are we going to commit to this? And the answer is, it's going to be dependent upon what we see as our internal capacity to deal with the issue. In other words, if we can do 5,000 homes, or we can do 10,000 homes, either for lead paint or for lead laterals, if we've got the workforce to do it, I'm certainly interested in doing that.
Gotcha. And yes, I'm just going to remind everyone again, this is a Listen MKE event. It's a partnership between WUWM, Milwaukee's NPR, the Ideas Lab at the Milwaukee Journal Sentinel, the Milwaukee Public Library, and Milwaukee Public Television. I got a viewer question that I think might might go to the commissioner or to the mayor. I'm not sure, but it's around landlord responsibility. They're responsible for mitigating hazardous conditions to their rental properties. What is the city's role in holding landlords responsible for lead-safe environments so that before children are poisoned? And what remedies are there for tenants and consequences for landlords who are not reaching those safety thresholds?
So that's a great question. I can speak from the health department's perspective. When we do a lead inspection, we will write lead abatement orders, and the landlord or the property owner is responsible for doing that work. We do have resources as well to help assist in having that work done. We have a cadre of contractors that we work directly with to get the work done as well. And in terms of enforcement, I think I'll let the mayor weigh in on that. But there is a process in place.
I'm still having technology issues here, so I apologize for not hearing the questions. I know that the health commissioner just kicked. And I
oh yeah, no problem. The question was around
try
landlord.
The question one more time.
Yeah, it was around landlord responsibilities for mitigating hazardous conditions, and it was asking kind of what enforcement there is.
I'll try the best. If you can hear me, I'll try. I heard the word landlord, so I think right now, as much as anything, we want to deal with as many pieces of property as we can. And so, of course, we want landlords to be responsible. But for me, it's all about what can we do and how quickly can we deal with the real issue, which is remediating this. And again, we do have the federal dollars now. And so let's take advantage of that. And let's see if we can work with the landlords to do it, as opposed to taking a punitive approach. There are certain regulations as to what landlords have to do, but I'm viewing this really through the prism of a public health issue and how we can use these once in a generational federal resources to deal with the lead problem. I don't want to go into litigation for 10 years because every year we're in litigation, we're going to have more kids, they're going to have elevated lead levels.
Superintendent Dettmer, I keep calling on you, but you did mention water filtration earlier in your comments. So does the city have a plan for widespread distribution of lead-safe water filtration systems or water pitchers as an interim measure during what seems to be a long process of lateral replacement?
So I'll start this off, but I will pass it over to Commissioner Johnson because I think the health department has probably the most important voice in this discussion. We have so Milwaukee Waterworks has a filter distribution program, and the health department has a filter distribution program, and it's really modeled on the type or the reason for the filtering. So Milwaukee Waterworks will provide filters when a lead service line is mandated to be replaced. So that would be if there's a failure in the lead service line, if there is a planned project, a water main replacement project or a paving project where we're planning to replace all the lead service lines as well. We provide water filters for those occupants to use prior to, if it's a failure, but then also during the service line replacement, as well as for at least 30 days afterwards. That timing may change a little bit based on the lead and copper rule revisions. For childcare facilities, we mandate replacement for all the lead service lines that may be associated with a childcare facility. So if they've applied to locate to a property, then we provide them actually bottled water service so that we could ensure that any water that they are drinking or using for cooking or making formula for the children in that facility, that is lead-free. And then we will do sampling after the lead service line is replaced to ensure that lead is meeting World Health Organization standards for bottled water, which is under 5 parts per billion. So still, not a health-based standard of below or non-detectable levels, but what is feasible for water. And then I'll pass it over to Kirsten to talk about the health department's program, because our distribution of filters is really associated with the projects that may increase lead and water at the tap. The health department's is really associated with the populations that may be at risk based on increased lead and water at the tap.
Correct. Thank you, Superintendent Dettmer. So I can speak to our water filter program is really based on identifying families who may be at higher risk. So women who are pregnant or thinking about becoming pregnant, or children 6 and under. So we have through our WIC, Women, Infant, and Children's program, which is a supplemental nutrition program. We provide water filters through that work, and then we also are partnering and looking to partner with our hospital systems and other organizations to provide water filters and water pitchers to families who would be in that population who are at higher risk as well.
Great. So while I have you, Commissioner Johnson, what's some information that you might share with parents? The last time that we talked about lead through the Listen MKE program was with a doctor and a parent whose child has been impacted by lead. So in terms of preventative measures that families can look at based on where they're living, whether lead paint may be present and or the lead pipe issue or those issues that we've discussed in terms of water. Can you give some, basic preventative, what should parents be doing and thinking about when they have young children in particular?
Absolutely. So the first thing we recommend, and this is really because of the pandemic, we are anticipating that we're going to see a number of children who have increased or elevated blood lead levels. As the kids go to their doctor's appointments and their annual checkups, which may have been missed last year because of the pandemic, that we'll see an increased number of kids who've been impacted who potentially don't know. But if you're living in an older home, which we know a large percentage of the housing stock in Milwaukee is older homes, we recommend that, especially as we're moving into spring and summer and windows are being opened and shut, that the dust and the flakes of paint that come off of those windows that get cleaned up and wiped down regularly, that you dust and vacuum. You wash kids' hands and make sure they take off their shoes. So when they're outside playing around houses that potentially are painted with lead paint, and the flakes are falling off into the soil. So we know soil is another source of contamination. Again, washing hands and feet, taking shoes off when you come indoors, vacuuming, wiping down potentially the dust or the flakes that come off of windows from opening and shutting them. Those are really some major areas where we see kids potentially being exposed. And if you're doing any work in your home, if you have an older house built anytime before 1970s, it's likely that there's lead paint on the walls. So if you're sanding or patching holes in your drywall or in your it's highly likely that there's paint. So any dust that gets generated from home renovation or work in the house is another source that we would likely see kids being exposed.
Gotcha. And I have a question for Superintendent Dettmer, which is a viewer question. And they were wondering how the decision gets made on kind of where the replacements are made. So how does that work?
So currently, as I mentioned, we are our lead service line replacement mandate, so that when it's required to have a full lead service line replacement from the water main all the way to the meter in the house or property is based on the 3 criteria. So number 1, child care facilities and schools. Well, we currently don't have any schools that have lead service lines feeding water, serving water to that property. So we had 10 schools in 2017 when we started our program that the service lines were replaced in very short order. The schools that have issues with lead in water currently are struggling with the old internal plumbing and fixtures that may be contributing to the lead in water at the tap. Child care facilities, as I mentioned, again, we look for the child care facilities that have applied to open, that is certified or licensed child care facilities. And we contact them. We prioritize them for replacements because we want to ensure that if and when that child care facility does open up, they are operating without a lead service line, that water has been cleared. Then we look to failures. So if you have a leak in your service line, if your curb stop requires some maintenance of some sort, it is mandated for those to be replaced. And following that, it's planned projects. So water main replacement projects, we have a robust criteria of how we identify which water mains to replace. That's based on the number of breaks, the age of the pipe, the material of the pipe, the size of the water main. And we are currently on track to replace 20 miles of water main in this year alone. So with that, if there are any lead service lines associated or connected to that water main, those are mandated for replacement. Finally, just this last fall, we added paving projects to that list. So previously, based on some studies, we knew that there was a limited potential of increasing the lead in water at the tap if there was a paving project. And we decided that we are going to go ahead and replace those lead service lines that are associated with it within the paving limits associated with the paving project prior to that project occurring, even if the water main is not planned for replacement based on, again, that the age of the water main, the piping material, and the number of main breaks that we've seen in that area. So that is really our current priority. As the mayor mentioned, he's tasked us with putting together a number of different strategies that we will adjust those priorities or add to those priorities, I should say, if we have the federal funding and the workforce that we can ramp up our program.
Gotcha. And that person did ask about how they would know. There is a website where you can look up your address through the city. So people can definitely take advantage of that. So I have a question for the commissioner and the mayor, but he's not here. Yeah, so it's kind of about that study, as well as other studies that have come out. There was one in 2019 that found a correlation between elevated blood lead levels and the risk of being involved in gun violence. There's been other studies done connecting issues of juvenile delinquency or issues of other instances of violence. And I'm wondering, is there education or programs for those who are adversely affected by lead? What is kind of the plan to investigate and address long-term human costs of lead poisoning?
That's a really good question. So we are internally really talking about the research that we're seeing come out around the long-term effects of lead in children as they become adults. This has been a multi-generational problem in Milwaukee. We recognize elevated blood lead levels at a population level have an impact on a child's IQ and development, which from my perspective is very concerning. We absolutely want to make sure that we prevent that from happening at all. But also, how do we address children and families who've already been adversely affected? So again, with these funds potentially coming into the city and the opportunity to have a really robust and comprehensive program, that's something we're absolutely looking at. And how do we address this sort of through the life course?
Gotcha. And I think, Susan, you have the last question. It was around testing.
Yes, we've received actually questions about this as well. Is there the opportunity for older members of the community to be tested? And is the city in the process of developing a comprehensive testing system, perhaps we know some kids at certain times are tested when they're very young, but that doesn't seem to be uniform. Is there a project in the works to create a comprehensive testing program?
Yes, so we have been talking about how do we do that. So there has not been a comprehensive testing strategy. Our medical director, Dr. Heather Parody, is a specialist in lead in children. Specifically, she's a pediatrician, but we have had conversations about how do we incorporate testing in lead for women who are thinking about being pregnant or prenatally. So we know that there are certain times in people's lives when if they were exposed to lead as children, that it starts to leach out of their bodies during gestation is one of them. So that's a high priority for us to identify or have a testing strategy around that. Best practice in the United States, and I believe it's Ohio, I'm sorry, or maybe New York, so I don't want to speak out of turn, but there is a program that has more comprehensive, like even a lead testing program or comprehensive lead organization that I think is housed either in a medical facility or a health department, but their entire job is a medical facility focused on lead, again, through the life course. So from testing to treatment to abatement, and really sort of simple solutions that you can employ in your own home, rugs, again, making sure that there's no paint chipping, et cetera. But yes, it's absolutely something part of our more comprehensive plan. It hasn't been done historically, but it's a need that we have identified.
Gotcha. And we really want to thank Mayor Barrett, Superintendent Dettmer, and Commissioner Johnson so much for joining us, as well as all of you out there, as well as all of those who submitted questions. This has been another installment of Listen MKE, which is a partnership between WUWM, Milwaukee's NPR, the Ideas Lab at the Milwaukee Journal Sentinel, the Milwaukee Public Library, and Milwaukee Public Television. Thank you so much. Really appreciate it. Good conversation.
Thank you for having us.
Thank you both.